Mar, a 23-year-old nurse, came to see me because of chronic insomnia. She would sleep 5-6 hours tolerating well, but in the last 3 months, a secondary insomnia developed at the same time. Once asleep, she would wake up with palpitations and anxiety. The context for this anxiety was a hidden relationship she had with a man, which caused her insecurity and discomfort. For the past 4 years, after having undergone a maxillofacial surgery to correct a facial asymmetry, her right cheek was still swollen. I'd like to take this opportunity to point out that facial asymmetries often indicate an alteration of the Qiao mice. She also suffered from chronic hemifrontal headaches on the right, often triggered by wind. Other complaints included bruxism, asthma that had started in childhood, and laterocervicalgia in the Taiyang and Shaoyang areas since teenagerhood. As a background, there were occasional right sciatica pains. Mar was hyperlax. She tended to slouch when feeling tired and, in response to my question, acknowledged that she sprained her ankles easily. She had been an obese child, but regained a normal weight in her adolescence. She had low self-esteem at an archetypically feminine level, probably inherited from an insecure mother who was always dissatisfied. Her father was self-centered, rather contemptuous, and unwilling to support her in her professional studies. When she came to my clinic, she had been living and feeling alone for the past 2 years. Introverted, she felt misunderstood and believed that she would not be able to communicate with anyone. When I met her, she did not seem to be able to free herself from the attachment of that hidden relationship in which she did not seem to be much involved. Regarding the Extraordinary Meridians, I wonder whether she had a deficient Yin Qiao Mai. I also considered the probability of attention at the Yang Wei Mai level as a defense against the inner fragility she felt. In the first visit, I needled kidney 6 alone and only on the right side, just where her pain and swelling were located. A week later, she reported, "Maybe I feel a bit better." She had not had headache or neck pain. I repeated kidney 6, this time contralateral, which is another approach, together with gallbladder 20, on the right side. After 1 week, she explained that for 24 hours she had felt great, but afterwards went back as before. This time I repeated kidney 6 left, together with gallbladder 38 on the right side. After 15 days, she confessed to having fallen asleep watching TV some days. As she was on summer holidays, I advised her to switch off the alarm clock. In summary, over the course of 5 sessions, I repeated kidney 6 stimulation on a couple more occasions, after which I discharged her. I have known from a friend of hers that she is still free from insomnia. Susanna, 43, had been diagnosed with irritable bowel syndrome for the past 2 years. Symptoms consisted of several diarrheal episodes per day, often triggered by emotions, both anxiety with a feeling of precordial tightness and anger. Her stools were soft, foul-smelling, hot, with mucus and lianteric, that is, elongated and shapeless, and were preceded by tenesmus, which is a painful constriction in her guts, which relieved after defecation. After the diarrhea, she was often overcome by a feeling of sadness. Her pathological history included an extended hysterectomy, uterus and ovaries due to uterine carcinoma, and cystitis. On the other hand, she had always alternated constipation and diarrhea. Her menses, which started at 13, were painful. Her bleeding, every 21 days, was heavy and accompanied by clots. She also had severe premenstrual syndrome. She was always very bloated, hyperemotional, and cyclodemic. As for her childhood, she had felt rejected by her mother, who was a very distant person, and felt emotional while telling me about her father's death. That occurred when she was only 7 years old. As a child, they were always moving house. This made her feel as a stranger in her, now and again, new school. By not having a stable environment, Susanna felt uprooted. Apart from her Zhangfu diagnosis, I considered the alteration of a Qiao Mai. Why? Because of her emotional uprooting, because of the uterine carcinoma, which may be related to other extraordinary vessels, but remember that Yin Qiao also circulates in the lower abdomen, because of the diarrhea, and because of her anxiety and sensation in the chest. I started the treatment by needling kidney 6, Yin Qiao Mai's creative point. A week later, Susanna felt calmer. The diarrhea and the abdominal pain that preceded it have subsided. I repeated kidney 6. The following week, I found her calmer, although 50% diarrhea persisted, along with some digestive discomfort. Based on that Zhangfu diagnosis, I felt obliged to use other points, so for 3 weeks I successively stimulate her with spleen 12, gallbladder 34 together with large intestine 11, and liver 13 with kidney 7. Please take note that among these, I was using also Yin Qiao Mai points as spleen 12 and kidney 7. As on the whole, Susanna was significantly better, we switched to fortnightly treatment, after which I decided not to give her further appointments, but told her to call me if she felt unwell in the future. I saw her for the last time in 2007. In this case, although the treatment of her Zhangfu had played its part, it was clearly the needling of kidney 6 that created the turning point of her clinical evolution. In my opinion, if the fundamental aspect, uprooting, had not been addressed, her symptoms would not have been resolved as definitely as they did.